Okay, good afternoon, everyone. Welcome to today's Global Affairs and Planetary Health Seminar Series. I'm Laurent Nelson. I am the Associate Dean of Global Affairs and Planetary Health, and I'll be moderating today's event. As you know, we continue to witness the ways in which events around the world necessitate movement of people between geographies. Sometimes these are, this can be an exodus from a homeland or people fleeing political, economic, or even environmental devastation. But many of us are beginning to understand that these movements can also come with psychological trauma that can impact large proportion of communities where people come from, and that this trauma can also be present among a large proportion of those in the places where they've settled. There's more that we need to understand about the impacts of migration on mental health. And today we're honored to learn more about this topic from Dr. Oscar Rojas Perez. Dr. Rojas Perez is a postdoctoral associate at the Yale Program for Recovery and Community Health and a licensed clinical psychologist. Dr. Rojas Perez has mostly studied Latinx psychological well-being, trauma, and culturally responsive measures and interventions for Latinx people. He provides culturally responsive care through the use of motivational interviewing and cognitive behavioral therapy. And finally, Oscar was himself born in Guatemala City, Guatemala, and immigrated to the United States with his family when he was 5 years old. We're very pleased to have an encore presentation. We had the pleasure of having him with us last academic year, but very happy to welcome you again. Thank you, Dr. Rojas Perez.
Great. Thank you. Thank you for that wonderful introduction. And I'll go ahead and get started. That way we have enough time to cover the whole presentation in itself. Great. So I'm hoping everyone's able to see my screen here. We're good? Great. So thank you, Dr. Nelson, for that wonderful introduction. And before I get started, I want to express my gratitude to the Yale School of Nursing Office of Global Affairs and Planetary Health for the invitation to present on the impact of migration on the mental health of Latinx immigrants. The agenda for our time together includes a brief introduction on the Latinx population in the United States, just to orient ourselves, followed by migration patterns and what that looks like. That will lead us into the mental health related concerns among the Latinx immigrant community in the United States, with a specific focus on historical trauma and present day trauma and what that looks like. Then we will start closing it up with Latinx well-being in terms of trying to see what can we do to enhance their overall mental health. And we will end with recommendations on how to better serve and advocate for the Latinx community in the United States. And we'll have about 10 minutes at the end for questions and answers. Before moving forward, I want to note we will be discussing events that have been deemed traumatic and showing images that can be triggering and prompt uncomfortable emotions and thoughts. I just wanted to put that out there for folks to be aware. To set the stage, I want to highlight this quote by Lila Watson. If you've come to help me, you're wasting your time. But if you've come because your liberation is bound up with mine, then let us work together. Essentially, what this is saying is that we need to understand the context, in this case, migration context, before we engage in any liberation work. And knowing the context will give us insights into the lived experience of the people that we are working with. In Latinx psychology, we stress the importance of knowing the context when working with minoritized and vulnerable populations, because we understand that there are structural factors purposefully designed to intentionally harm Black and Brown communities. So in essence, knowing the context in terms of our role in the liberation of folks of color is very critical as we engage in liberation work. Now, I want to emphasize that it's challenging to talk about the mental health of Latinx immigrants without considering the social justice sphere and political implications. As a result, the goal is to discuss the implications of systems and policies on the social, community, individual, and family of Latinx immigrants, which typically brings this topic to the forefront of mental health practice. So let's briefly take a dive into the Latinx population in the United States and what that looks like. So according to the 2020 census, Latinx in the United States are highly represented in the West Coast, Southwest, and East Coast. And there are very many reasons and histories as to why we see a large number of Latinx folks in these areas. So you see them concentrated mostly in California, a lot of the Southwest, and then we see some here in the Northeast, and a lot in Florida as well. So one of the reasons, and I'll very brief example as to why we see Latinx populations in certain regions of the US. Let's take, for example, what the United States looked like before the US-Mexico War. This is what it looked like prior to the US taking over what the majority of Mexican territory. We see here that Mexico was way bigger than the United States. After the war, the US took almost half of Mexico. I won't bore you with the details, but it's important to know this because it provides us with the context. But yes, you start to see after the Mexican-US war, we see the expansion of the US, what is now California, Arizona, New Mexico, Texas, Nevada, and so on. But this is just kind of like that representation here. A key point that I want to make is that Mexican and other Latinx groups did not cross the border. It's important to recognize that the border crossed us. Now let's look at what we know about the Latinx community. So outside of Latin America, the United States is home to the largest Latinx population, making them the second largest ethnic group behind non-Latinx whites. When working with the Latinx community, it's important to recognize the diversity and heterogeneity that exists within the Latinx community, ranging from language, dialect, culture, heritage, nationalities, race and ethnicity, inclusive of Afro-Latinx individuals and communities, religion and spiritual orientations, and documentation status, which brings this at the core of our current political climate. It's important to consider regional differences among Latinxs. Take, for example, in the West Coast, one is more likely to work with and encounter individuals of Mexican and Central American origins, while in the East Coast, we're more likely to work with and encounter individuals from the Caribbean. This includes Dominicanos, Puerto Ricanos, and Cubanos. Here in Connecticut, we have our largest Latinx population is the Puerto Rican community, accounting for more than half of the Latinx population, which we see that representation high here in New Haven as well. So to bring it back globally, or largely systemically, today the Latinx population accounts for 19% of all people in the United States. Of the 19%, 19.8 million have been reported being born outside of the United States. That's a huge number of folks who are considered deemed foreign born. Latinx are also projected to account for 28% of the population by 2060. As you start to see here, the numbers are only growing and growing. These numbers highlight, and I'm going to stress, they highlight the browning of America that is taking place right before our eyes. Trends in Latinx growth have been associated with migration. However, it's important to know that in the last decade, migration to the US, to Latin America, has slowed down. And what we are seeing is a shift in migration backwards. So we're seeing folks from the United States migrate to Mexico. Migration from the US to Mexico and other parts of Central America and other regions of Latin America is a result of an anti-immigrant climate that we've been experiencing, economic challenges, and immigration raids. Regardless, Latinx immigrants continue to make up the majority of the foreign-born population in the United States, with individuals of Mexican ancestry representing more than half of Latinx immigrants, followed by Puerto Ricanos, Cubanos, and Salvadoreños. Additionally, it's also important to highlight that since the start of 2021, there has been an increase in the number of migrants at the southern border, which is the result of a humanitarian crisis in Central America that has been years in the making, resulting from natural disasters, gang violence, corruptions, and high rates of femicide, which is violence and murder against women for simply being women. And we're starting to see that in the past 10 years, Central America has become the murder capital for women in all of the world. So we're starting to see a lot of femicide in the past 10 years in Central America, specifically in the Northern Triangle. In March of 2021, US authorities apprehended more than 171,000 migrants at the US-Mexico border. That's the highest monthly total in 2 decades. The total includes 19,000 unaccompanied migrant children, 53,000 family members traveling together, and 99,000 single adults. Now, I want to highlight that the unaccompanied minor crisis we are experiencing is nothing new. When we look at the history of Latin America, specifically Central America, we see that the unaccompanied migrant children crisis or situation has been occurring since the 1980s as a result of the civil wars in Central America, in which parents would send their children to avoid them being recruited by the military and guerrilla forces. Now, one thing that I want to highlight too is the distinctions in immigration policies in terms of how friendly or unfriendly they are to people of color, as we're starting to see policies shift for Ukrainian folks, right? So when we look at colorism and when we look at how the US values color, we start to see that there's shift. They tend to be more in favor for folks who tend to come from European regions. And we see that all throughout our policies historically in the United States, right? So we start to see essentially systemic racism in our policies of immigration. Now, let's take a brief dive into reasons for migration and migration patterns and what that has looked like over the years, and essentially over the last 100 years or so. So migration from Latin America to the United States is rooted in what has been described as push-pull factors. For example, an economic crisis, which often leads to high rates of poverty, can push people to migrate to the United States, while economic opportunities in the US can pull people into the US. Gangs, political violence, and corrupt governments push people out of their home country as a result of instability and fear of being murdered. While family reunification, healthcare system, and educational opportunities can pull people to the United States. So we're starting to see different reasons, and in literature, they've often been described as push-pull factors in migration. It's also important to recognize that there has been a change in migration trends. Before, it was common for people to migrate voluntarily to the United States, and we see that in the 80s and 90s as people were just coming chasing the American dream. But this idea that the American dream is no longer relevant or no longer really exists. However, in the last 10 years, people have left the United States because of the economic challenges. We saw the crisis of 2009, which prompted a lot of migrant folk, a lot of immigrant folk to migrate back to their country of origin. Today, common reasons why migrants come to the United States is because of climate change in their country of origin, which is something that we didn't think about in the past couple of decades. But we're starting to see how climate change is having a significant impact in migration and reasons why people are migrating to different parts of the world. There's a growing number of evidence that climate extremes have been essentially devastating and having a devastating impact on agriculture in Central America, affecting the livelihoods of millions of farmers and serving as a main driving reason as to why people are migrating, specifically from rural regions of Central America. Both droughts and floods have been shown to have serious financial impact in many rural areas. As a result, many families have experienced both food insecurity and financial instability, prompting them to leave their country of origin. Similarly, violence stemming from gang rivalry and extortion by influential criminal organizations remains a severe problem in Latin America. Gang-related violence is an essential factor prompting people, including unaccompanied minor children and young adults, to leave their country of origin. So we're starting to see parents continue to battle the same thing that they were experiencing in the 90s and in the 80s and 90s. So in order for their children to survive, they're sending them to the US because they want to avoid them being recruited by gangs. Finally, it's important to note that the migrant woman is now the face of migration, with many studies citing the largest number of women in the last 10 years migrating to the United States as a result of femicide. So historically, you've seen migration patterns show that men tend to be the ones who come to the US for economic opportunities. They come, they work, they send money back home. This shift in the last 10 years has been where we're starting to see more women and children come to the US as a result of just essentially survival. It's no longer as a result of economic mobility or economic upward prosperity. Essentially, it's just a sense of survival. So we're starting to see women and children leading the packs in terms of numbers of migrating to the US from Latin America. When we think about it, these are just seen as perceptions of survival, upward mobility, and opportunity. To better understand mental health inequities experienced among the Latinx immigrant community in the United States, it's important to recognize events in Latin America that push people to the United States. U.S. social political factors that pull Latinx immigrants to the United States, and legislation that have fueled undocumented migration from Latin America to the United States, in addition to the impact structural racism has had on the mental health of Latinx immigrants once in the United States. So it doesn't just stop, it doesn't start or stop in the country of origin or in the country where they end up, in this case, the United States. In popular discourse, mental health inequities within Latinx immigrant communities is often discussed from a social determinants of health lens, which we see in the literature, and it has been well documented the social inequities experienced among racial and ethnic minoritized communities, in this case, the Latinx community. However, what is often omitted from discussions are the structures purposefully designed to negatively impact the mental health of Latinx immigrants. Essentially, what is often not discussed is how social inequities of health are a product of structural racism and colonialization. Therefore, it is important to recognize the mental health inequities experienced by our Latinx immigrant community and how they're rooted in colonialization, structural racism, fueling migration to the United States. So it's not just it's happening in the US, what's happening in the US, but it's also how the US has influenced other parts of the world as a result of power. The origins of Latin immigrant migration and Latin immigrant mental health concerns can be traced to migration to the United States, which is complex and rooted in US territorial and economic expansion and heavily involvement in Latin America, especially in Mexico and the Northern Triangle throughout the 1950s, even till today. Yet Latinx migration to the United States in popular discourse is often discussed as a personal decision made by an individual and family, essentially what we see in the movies, this American dream. But what is often overlooked and left out of discussion are the structural factors, microeconomic context that influence the decision to leave, and US political and economic involvement in the country of origin. What is also left out of discussion is how people would rather remain in their country of origin than actually leave and come to the US. A lot of the research often talks about this prosperity reasons, but when we interview folks and what we see through qualitative interviews is that folks don't want to leave their country of origin. They want to stay with family, their community, a place that they know, a place that they call home, but sometimes their survival is on the line, and that survival means staying alive, which then prompts them to leave to the US. In addition, it's also important to recognize the influence major US legislation has had on Latinx migration. Take, for example, here we see the Bracero program during World War II, which opened the doors to Mexican guest workers. And that has reshaped many times, and today we still have a Bracero program. It's just under a certain visa name now. Similarly, it's important to recognize the past, current, and federal legislation affecting migration to the US. So take, for example, past legislation that fueled migration was the Immigration Reform Control Act of 1986, and current policies such as the Temporary Protective Status for Venezuelans or the Migration Protection Protocol, which is the Remain in Mexico policy. Folks may also be asking, well, what do migration patterns have to do with mental health? Well, migration patterns provide contextual information on what was occurring at said time and how these events are impacting the mental health of immigrants. So we can look at, was there a natural disaster that prompted migration? What are the violence rates going on? Was there a war? Was there, what was the crises that was impacting folks, or essentially the main reason why folks are migrating? So migration patterns give us insight into stressful events occurring and contributing to trauma, post-traumatic stress, and other mental health concerns. What was causing family separation at said time? So take, for example, the Bracero program where the civil wars, essentially family separation has been occurring for many years. Or immigration policy contributing to the mistrust often experienced by Latinx folks, which manifests in the mistrust of mental and physical health systems. So this is why we're starting to see a difference in who access health services in general. As noted in the previous slide, there are structural legislation that directly and indirectly influence migration, which impacts mental health of Latinx immigrants, which produces social inequities of health. Laws and policies across different levels, whether that be federal, state, and local, have had and continue to have a negative impact on the mental health of Latinx immigrants, especially the undocumented community. So it's important to distinguish those who are immigrant with documentation status and those who are immigrant without documentation status. Oftentimes, policies and legislation include administration rules that limit essentially access to education, healthcare insurance, food assistance, and economic opportunities. And we see that now playing out with folks who are DACA recipients and what that means for them, and how that DACA status and research has shown that in the immediate present, it has a relief, but in the long run, it has a more severe impact on their mental health and actually reducing stress. There's also been an increase in funding for the enforcement of federal immigration law. At the federal level, there has been record level deportations in recent years compared to the early 2000s. So laws and policies that restrict immigration have had a negative effect on Latinx communities, including the likelihood of US-born children growing up with a single parent or without parents because they're undocumented. And we're starting to see immigration rates in the past 5 years increase so much, which results in children growing up in poverty, essentially obtaining lower educational aspirations and low civic engagement in general. At the individual level, restrictive immigration policies result in heightened fear, restrictive mobility. Few folks don't want to come out because of fear of being deported. Distrust in law enforcement, and which we saw in the past 2 years since COVID, an increase in IPV that didn't go reported because of fear of encountering law enforcement, in which that has been shown significantly over the past 10 years, but more in these past 2 years. For example, and it's important to recognize just the impact, and I'll go into more detail in the next couple of slides, but when we look at just mental health concerns, one study found high levels of depression and anxiety among Latinx immigrant men as a result of settling in states with tough immigration enforcement policies. And this study was conducted in the South, specifically Alabama, as you're starting to see different laws going into place, or that have already been in place. Similarly, a second study found that among a sample of 326 Latinx adults, 55 and older, who participated in this study, who had experienced hardships as a result of their immigration status or just laws in general, they reported low use of government services. They perceived the current situation, the current climate for Latinx as worse than they did in the past, had a great fear of deportation, and perceived overall, they reported having lower quality of life and lower expectations that things would get better. So essentially, immigration enforcement also results in fear and anxiety around deportation. The chronic anticipatory stress can lead to social isolation, limiting access to health and social service and economic uncertainties. So by default, these experiences leave immigrants, especially undocumented Latinx immigrants, at a disadvantage, meaning increased likelihood of living in poverty, limited access to service, living in densely populated areas, which has been described as a social determinants of health, but in essence is a product of structural racism. Now we're going to shift gears and look at the mental health of Latinx immigrants once they're in the US and also through the migration experience. So what is the research telling us? I do want to start off by saying that not all migration journeys are the same. It's important to know that often what we see in the media or what is really discussed are the later waves of migration. And when we think about migration and how that is experienced, there's a class and color distinction. People who tend to come in the first wave and even second wave, and they're called waves of migration based on who's coming at set time, but the first and second wave tend to be folks of higher SES who tend to, when we think of just skin tone, they tend to be on the wider side of the spectrum. So they tend to have more European looks. So they're higher SES, white passing, and therefore their travels to the US look very different than the third and fourth wave. We start to see folks who are higher SES, white passing, or who have white features. They tend to come, their journey tends to be less harsh. It's much more easier because they essentially have access to visas and whatnot. So their migration journey looks much more different than third and fourth wave folks who tend to have more indigenous features, who are lower SES, and their journeys tend to be more dangerous, as you start to see here. So I just want to make note that there is a distinction in migration for the first, second, third, fourth wave, and it's a result of socioeconomic status and also in terms of how you identify phenotypically or how you perceive phenotypically. So a growing body of research has demonstrated that immigrants, regardless of legal status, encounter significant stress prior, during, and after migration. Some examples of pre-migration stress include political instability, persecution, war, violence, poverty, natural disasters, and recently, in December of 2020, 2 Category 5 hurricanes that struck Central America. The research that has been done suggests that pre-migration factors are most directly linked to poor mental health outcomes once in the United States. So for example, one study found that Latinx who had experienced extreme poverty, political or gang violence, exposed to natural disasters or other traumatic events in their country of origin, were more likely to experience poor negative mental health concerns in the United States. Similarly, a second study on Latinx immigrants found that those living in Northern Carolina, majority who were undocumented, who had experienced poverty or a major life event in their country of origin, were more likely to report symptoms of depression once in the United States. Finally, a third study found that Latinx immigrants who had experienced trauma prior to migration were more likely to meet criteria for full and post-traumatic stress disorder once in the United States. Now, examples in stress during migration include having to travel through remote deserts, mountains, hazardous rivers such as the Rio Grande, which you see here, which when we think about it, is no easy task. And we're starting to see in the news of folks, adults and children being found at the end of the Rio Grande, essentially, who tried to cross and didn't make it. Oftentimes, migrants are exposed to high temperatures and limited access to food or water. Several studies have documented the risk of dehydration, heat strokes, injuries, violence, and even death. Additional stressors along the journey include exposure to physical, verbal, psychological, and sexual abuse, family separation, and for women, rape. There is a lot of studies that show that women in the past 10 years have been, before they make their journey to the US, start birth control, because the likelihood of them being sexually assaulted or raped are really high. These traumatic events can even have a serious and lasting impact on the mental health of Latinx immigrants and their family members. In recent years, trauma experience may include, when we think about our younger generation, our younger populations, essentially the little people, our kids, detention center trauma and what that looks like and how that may manifest in the future. We already see that Latinx adults don't trust health agencies, and we're thinking about essentially now, and research is showing that our young population wants nothing to do with any institution, which has been historically what we see with minoritized populations. Examples of post-migration stressors are a result of policies and social factors or climate in the United States. So once undocumented Latinx immigrants are settled in the United States, a number of political and social factors that impact their mental health include immigration policies, change in social networks, and essentially experiences of discrimination and racism. Research has shown that Latinx immigrants, once they are in the United States, essentially are always encountering marginalization, socioeconomic challenges, reduced social and physical integration into the broader community, and stigma associated with the undocumented status, regardless of documentation status, right? There is this perception that all Latinx folks are undocumented, which we know is not true, but there's constant fear of being associated with that. So when we think about that, what does that do to one's identity development? Poor mental health outcomes such as depression and anxiety and trauma are further magnified for undocumented immigrants, including our deferred action for childhood arrival or DACA recipients who struggle with the perpetual fear of deportation. Although there are no large studies on the mental health of Latinx immigrants, essentially what we've seen in community-based samples suggests that depression and anxiety are more common among Latinx immigrant women, while alcohol use is a more common concern among men. So we start to see the difference in terms of how mental health concerns start to manifest. For women, it tends to be more mood and anxiety. And for men, we're starting to see more alcohol, drug use as they try to cope with the difficulties. Such prolonged exposure to social adversity has negatively affected the physical, psychological, and socioeconomic health of Latinx immigrants in the United States and their families back in their country of origin. So it's not just the individual, but also who they're leaving behind. And in the research that we just discussed, let's think about the experiences of historical trauma or generational trauma. which is the transferring of trauma between generations, and collective trauma, which is the psychological reaction to a traumatic event shaped by any group of people that can affect an entire society. So wars, natural disasters. The effects are substantial, essentially they're huge, and the process can destroy a person's sense of purpose, negatively impact their confidence in the world, affect their worldview, their perception of the self, their meaning system, mental health, and essentially their own self-worth. How do they perceive themselves? Historical trauma as a result of structural racism, oppression, and colonialization have laid a foundation for socioeconomic challenges experienced by our Latinx immigrant community, including high levels of poverty, underemployment, low educational attainment, oppression, discrimination, and racism. Additionally, social, cultural, and social environmental factors that impact the mental health of Latinx immigrants include targeted marketing of alcohol, accessibility to substances, living in disorganized neighborhoods, and an increase in police surveillance, which again is rooted in colonialization mentality. Historical trauma among Latinx immigrants has also been linked to mistrust in government institutions, unresolved ambiguous grief, anger, and land attachment disorder, which we're starting to see a lot of that manifest now. In essence, the mental health and substance use concerns have been linked to historical trauma and present-day trauma among our community. So recognizing the interlocking effects of colonialization, oppression, and marginalization as they are related to presenting mental health concerns and substance use concerns among a Latinx immigrant community is an important step in connecting structural causes to contemporary identity development concerns, intergenerational trauma, experiences of colorism, health, and overall just well-being. So it all connects, and it all has a significant impact on how one perceives himself and their placement in the world. In the past few years, several studies have investigated trauma experiences and related concerns among the Latinx immigrant community. So for example, studies examining the experience of DACA recipients. So these are folks who have been granted some sort of legal status. For the time being, we don't know what's going to happen with DACA. But what we're starting to see is that they're experiencing high psychological distress, identity development concerns, right? This idea that I'm not from the US, but I'm also not from a country of origin because I've grown up in the US. So I'm more aligned with the US-based cultural worldview, but there's also not a permanent status, right? They're not considered US citizens, so there's perpetual fear. We're also starting to see high trauma rates. Similarly, a qualitative study examining the impact of immigration legislation with Mexican immigrants found 3 themes, which included chronic stress, which essentially can transform into full-blown post-traumatic stress disorder. They also experienced fear of deportation and a sense of powerlessness coupled with trauma. A third study with undocumented Mexican immigrants found that they are at an increased risk for mood and anxiety disorders and trauma. A fourth study investigating the mental health rates found that 80% of their sample, which consisted of all asylum-seeking Salvadorian women, endorsed trauma and stress-related symptoms. A fifth study, which consisted of Mexican, Salvadorian, and Guatemalan primary care patients, found that 54% of their sample reported experiences of political violence, 8% reported experiences of torture, with 56% meeting criteria for full-blown post-traumatic stress disorder. A sixth study, which assessed a group of 46 Guatemalan immigrants for post-traumatic stress disorder and depression, found that 30% of the participants exhibited symptoms of post-traumatic stress disorder. And finally, results from a 2017 mixed method study investigating association between traumatic events and psychological distress among undocumented Mexican immigrants suggested that 82% of the 248 participants met criteria for post-traumatic stress disorder. That's 82%. Overall, these findings suggest that the impact is broad. When we think about historical oppression and trauma and the effects that it continues to have on our immigrant population, therefore affecting their overall wellness, their mental health, in addition, the generational consequences of violence and oppression for future generations. As a result, when working with Latinx immigrant folks, documented or undocumented, in any setting, it is important to conceptualize presenting concerns from a holistic approach, taking into account historical events, immigration policies at the various levels, in addition to social cultural factors. Furthermore, when working with immigrant populations as providers in any setting, we need to pay attention to meso-level factors, given that policies can impact the well-being of immigrant communities. So as providers, when working with Latinx immigrants, we should be curious about past trauma as a result of war, natural disasters, political persecution, gang violence, and experiences prior, during, and post-migration journey, as that may impact treatment engagement. In addition, this may take additional work, but we may need to be aware of federal legislation at all times and consider how immigration policies may be playing a role in access to care, treatment, adherence, and trust. What are public rulings, public policies are? What does that mean? Does it prompt individuals to not seek treatment because they're scared, essentially? And finally, taking a look at the local context and the role of structural racism. For example, how immigrant-friendly are our communities or the systems that we work in? Are they welcoming? Do they suggest or they encourage folks to come seek out treatment? It's important to really look at how our systems are set up. Well, the focus of the presentation thus far has been on barriers and poor mental health outcomes. I would like to shift gears and look at what we can do to improve the mental health of Latinx immigrants. So now we're going to focus, now we know the barriers, we know the policies, we've seen how policies can have an impact, and we see migration patterns, right? It all goes together. But what we do in psychology and what historically a problem has been is that, specifically when it comes to folks of color, is that we look at everything from a deficit lens. What our team has been doing is we're trying to shift the narrative and really work from a strength-based perspective and saying, we do have well-being, and let us tell you what does that look like. So I'm going to focus on that for these next 10 minutes and really honing in on what some of our findings suggest. So historically, and even present day, Latinx immigrant mental health, essentially well-being, is often conceptualized from a deficit approach, mostly focusing on the absence of psychopathology. Basically saying that Latinx immigrants folks may only experience well-being when they are not depressed, anxious, experiencing trauma symptoms, or substance use concerns. Basically what it's telling us is that if you're not experiencing those concerns, then that's the only way you can experience well-being. We think different. In the last decade, Latinx psychologists have made progress in challenging this narrative or this deficit approach to Latinx well-being. For example, one study found that among Latinx families and their children, the cultural value of familismo served as a protective factor against negative mental health outcomes or symptoms in general. A second study found that among 19 Latinx women and 8 men, harmonious familial relationships, a thriving family system, acts of kindness, influence, and protected against negative mental health outcomes. Similarly, a third study found that harmonious relationships with family, providing social support and fostering interdependence to be associated with positive well-being among a sample of 10 Latinx mothers. A fourth study found that familismo, an ethnic identity, to predict well-being amongst Latinx adolescents and protected against post-traumatic stress. So we're starting to see ethnic identity also be identified as a protective factor. And finally, a fifth study found that among college students, heritage retention contributed to well-being. These studies point to the importance of cultural indicators and how they can play a role in the well-being of Latinx immigrants and how we can use cultural healing methods, cultural strengths, cultural values, cultural practices to enhance well-being, to engage folks in treatment, to essentially, if we learn how to speak their language, then we're able to better serve them in all different ways. So in our efforts to contribute to the literature on what improves Latinx immigrant well-being, we sought out to investigate what contributes to Latinx well-being from a social, and cultural lens. Our approach was holistic. We wanted to know what are psychological factors, what does resiliency mean? What does that look like? What social factors, community support, access to resources, or what cultural practice really influence the mental health? And one of the things that we decided to do is oftentimes when we do research, we already come from a research lens. We've done the literature research, we've looked at studies, we've kind of done our own studies ourselves, but we already are coming in with a kind of biased lens. But our approach to this study was essentially just asking folks, what is well-being and what is mental health? So we took ourselves out of the equation. So results from our qualitative study that consisted of 10 participants, 5 men and 5 women, revealed 5 general themes that contributed to Latinx immigrant mental health, essentially well-being, therefore protecting against negative mental health outcomes. So in our study, there was one theme that emerged from the psychological dimension, which included tranquilidad interconectada, which translates to interconnected tranquility, and I'll go more into details in the next couple of slides. Another theme that surfaced from the social domain is only one, which we labeled convivir con los demás, translating to ability to share life with others. Two cultural themes surfaced. One was responsabilidad a la familia, responsibility to the family, and tener una relación con Dios y fe, which translates to having a relationship with God and faith. And our final theme, our fifth theme, was which was not part of our conceptualization in terms of the model that we use, but it surfaced through a lot of our interviews where folks talked about their physical health as their well-being, which we labeled salud, physical health, which is a new dimension that was not in the psychosocial cultural framework. So what did these findings look like and what are they saying? So psychologically, participants described well-being as experiencing a sense of tranquility, stemming from having knowledge that family and loved ones were emotionally and physically well. And we saw this through, you can see this through Leticia's comment, who was a Guatemalan immigrant who migrated to the United States to reunite with her family. Her well-being and the way she explained it was, I have my daily job, and when I return home from work, it doesn't not matter if my daughter has slept or not. I need to help her with the babies. Knowing that I can help my daughter provides me with tranquility. One of the things that we saw is that well-being for this sample was an other orientation, meaning that well-being was based or grounded on the well-being of those around them. So it wasn't about the self, which is really different from how US or Eurocentric frameworks have described well-being or mental health. From the social dimension, as mentioned, we found one theme, which was connectedness and the ability to spend quality time with family and loved ones were the most salient identified factors contributing to well-being. As you see here, Elizabeth, a Guatemalan immigrant who came to the US to reunite with her mother after 10 years, this is how she described well-being from a social lens. When you share life with others, you live your life. When you are too focused with work, one becomes closed. Therefore, in the moment that you are able to share life with others, as a Hispanic, for example, I sometimes travel to Texas. I am fascinated with Texas because we go and we are able to share life with my family there. We share, we laugh, and we dance, and we share life like family and friends. Afterwards, I arrive here, her hometown, and I arrive distressed. The people one shares life with, that is their well-being. As mentioned earlier, there were two cultural themes. One was responsibility to the family. Participants noted that well-being derived from engaging in behaviors that fulfilled family responsibility, such as service, providing support, and through life lessons informed by dichos or refranes, which are essentially cultural sayings that people use. Martin from Mexico, who came to the US at age 16, stated that his cultural well-being, or how he saw well-being from a cultural lens, is being able to help my family prosper and is most important in my life. That is why I came to the United States, to be able to help my family prosper, to have more opportunities so that they do not struggle, for them to live a decent life, and knowing that I'm able to help my family, that is my well-being. The other cultural theme was having a relationship with God and faith. And we saw this through, and you see this here through Leticia's comment, where she says, my well-being comes from the heavens above, from up above. God is the only one who can provide us with well-being. One must have God in their lives because he is the one that provides us with well-being and our daily bread. And finally, as mentioned, there was this physical aspect that we weren't thinking about, but surfaced through these qualitative interviews that was contributing to well-being. And we see here through Jose, who was a father of 3 and a restaurant owner. If I do not take care of my physical health, if I get sick from eating poorly or abuse food, if I consume food high in sugar, that could alter my blood sugar levels. I can become severely ill. It can even bring death. Being ill means not having well-being and will also affect the well-being of my family. So through emerging evidence from these qualitative analysis or qualitative interviews, we found that the concept of well-being differ from current models of well-being. Essentially, current models are very individualistic, with the self being at the center, which fosters independence, autonomy, and self-improvement. From our current sample, well-being was largely centered on the cultural value. Sorry about that. It was it was basically centered on the value of familismo and interpersonal factors. Across the 5 identified themes contributing to well-being, a majority of them, if not all, displace an other orientation component, which is unique and not seen in other models or theories of well-being. Faith and religiosity were also noteworthy when describing well-being in the current sample, which is consistent with previous findings suggesting and highlighting the importance of faith and of spiritual orientation among the Latinx community. It's also worth noting that belonging to a faith-based community has been identified as a source of social support and strength, contributing to our overall purpose among our Latinx community. It's also important to note that well-being was described as a holistic, being intertwined with the psychological, social, cultural, and spiritual factors, which when we think about the distinction in terms of how we do research and what our findings suggest is that in this case, Latinx and for the most part, people of color, we see things we approach things through a holistic approach or through a holistic lens, not this one-dimensional way, it's more combined. It's also important to note that well-being was discussed as and generally coming from the heavens above, from God, right? That there was a higher power that was blessing us with blessing us with opportunities. So what does this all mean as we start to look forward and move forward? So when working with Latinx immigrants, interventions may need to include aspects of family healing and consider well-being or just wellness of other family members, as that may be contributing to an individual's levels of distress, essentially working from a systems approach. We may want to ask, what is the role of family in this person's life and what support is family providing? Family can also be a stressor. Interventions may also need to focus on developing effective interpersonal relationships, community involvement, and establishing a strong social support system. We may also want to inquire about the role of spirituality, fatalismo, which is the belief, or fatalism, which is the belief that God plays a significant role in our daily lives. We may also want to assess adherence to cultural values. From research, we know that cultural values can serve as a protective factor, but we're also starting to see how they can be risk factors as well, especially within intergenerational differences. Finally, we want to gather contextual information to help us better understand presenting concerns. It's possible that the given situation, that the emotional distress or behavior is an appropriate response and not symptoms of psychological distress, right? So it's important the context can give us information as to like, hey, is this how a person would respond normally? Of course, but if not, then we start looking at psychological presenting concerns. Several sources also emphasize resilience response, including narrative of survival, pride in ethnic identity, cultural practices, kingship or traditions, dance, storytelling traditions, health practice, healing practice, cultural healing practices are also important, and especially and also asking for what is the role of the elders in their lives? How are elders perceived? Because elders can be really important in these communities. So in sum, when working with Latinx immigrants or clients in general, it's important to focus on both the symptoms of the presenting concern, at the same time looking at the interlocking effects of systems of oppression. So we're looking at both internal and external that can cause psychological distress and see how one may be overpowering the other. In addition, it's important to utilize interventions grounded on resilience and strengths that are responsive and that validate the lived experience of Latinx immigrants, particularly looking at things from an intersecting lens. So looking at their various identities, not just one. Healing interventions should be personalized, grounded on empowerment, and conceptualizing the client's strengths and values and worldview. We also may want to think about how we can integrate peers into our practices or into our systems, because peers are trusted individuals. From research, we see that Latinx rather take advice or recommendations from someone that they know than an institution. So moreover, as providers, we may need to show up in other ways. That may entail us engaging in collective activism to counteract structural racism that has produced health inequities within the Latinx immigrant community, and working collaboratively with community leaders, stakeholders who understand the cultural, language, and lived experience of Latinx immigrants to deliver accurate and culturally responsive healthcare information or messages. So what is the message that we're trying to get across? And what we see is that community leaders are so trusted that if we work closely with them, our message will get across. So essentially, we may think about the role of mediators or people in that middle role as being very critical. We also need to invest in the recruitment, training, and retention of bilingual and bicultural trainees. As we've seen, as I shared earlier, the browning of America is happening, and we're going to need more and more providers who look like us. So thank you for your time, and I'll open it up for questions.
Thank you, Dr. Rojas Perez. If there are questions, you can raise your hand using the reaction feature in Zoom. You can type it into the chat, or you can turn on your camera and ask it away. I had a question which was about the land attachment disorder. So I thought about how would you treat something like that?
That is a great question, especially when we look at the history of the U.S. and one of the things that some of the research that folks have been coming with, especially with indigenous community, we're starting to see that in the U.S. A lot of it has revolved around what is your relationship with the land, and what can you do to essentially embrace it and give it its gratitude for essentially the lands that are there. So essentially, cultural rituals to heal this, because there's this attachment to things, and we've seen that through psychology research that we tend to associate attachment to our belongings, but it's more in gratitude for what the land gives us, essentially nutrition, food, etc., and whatnot. So there's more of this healing practice with the land that a lot of researchers who are indigenous are bringing to the surface, which revolves around dances, prayers, to essentially detach from the land or what was stolen from you. So a lot of rich cultural rituals have been shown to be effective in the healing of this land attachment disorder.
Thank you for that.
Mm-hmm.
Oh, Ben Wong has his hand raised. Ben.
Hi, sorry I have my camera off. I've been present throughout the whole presentation though, and thoroughly enjoyed it. Thank you so much. I see so many parallels between Latinx mental health concerns and issues and Asian mental health concerns and issues. So this was really illuminating and affirming. So just wanted to express that gratitude up front. I'm also curious about the intergenerational transmission of trauma and the way that it impacts family dynamics. And at least among my very small circle, it feels like a lot of the family members who are, or at least thinking most about trauma and trying to do the work to heal are subsequent generations, immigrant generations. So second and third generation, at least Chinese Americans. I'll only speak about my family and the people that I know, and we're often the ones who are open to like therapeutic services, and these are often the things that we're working through with our own mental health professionals, and face a lot of resistance from our parents and our grandparents to even engage, which we understand, I think, as like a trauma response too. And so I guess my question is around like, do you work a lot around intergenerational trauma and impact on the family? If so, do you have any like resources or books that you'd recommend, or just insight?
Yeah, that's a great question, and ting you for bringing it up to the forefront. And you know, in psychology, we do have our racial and minoritized organizations, and we see a lot of the parallels among Black, Latinx, and Asian communities in terms of their experiences in the U.S. and migration in general and the impact that has had. And you're right, there is a drastic differences in terms of who seeks mental health, and we're starting to see that second, third, fourth, fifth generation folk are more likely to seek out mental health services and have more trust in institutions. And that's because that's a result of growing up in the U.S. or having more time in the U.S. compared to immigrant folk who essentially have been at the forefront, right? They're the ones who struggled, who came here, who essentially that laid that foundation. And one of the things, and that's been the biggest challenge, is how do we engage older generations in mental health treatment. And that's been the challenge, because the reason why we're starting to see that there is this disengagement is because of trust, and that distrust is completely valid. And I also want to take a step forward, take a step from that, because it's not just about mistrust, but when they do seek services, there aren't providers who speak the language, who look like them, who understand the cultural traditions, or who understand their worldview. So that's a systems level issue. So this mistrust is a systems level issue. And then the lack of providers, the lack of training is a systems level issue, because we're starting to see, or we've known, the, we struggle with yes, I'm going to say we struggle with recruitment, and then we struggle even more with retaining folks of color who can understand. And that's a result of just institution in general. So one of the things that we have been doing, and this is why I really stress the role of peers in treatment, is because older generations are more likely to trust someone that they know. So if a peer or a community leaders, or there are community health workers, we do a lot of that work with them, because they're that middle person. They are essentially our bridge to older generation, because the older generation is going to trust them because they're out there in the community. And therefore, if we're able to communicate that message through them, then it's going to get there. So engagement with community leaders, peers, peer navigators, community health workers, that is one way to bridge and bring older generation, first generation folks into accessing treatment, into developing that trust. If that trust is there, and if they know that that peer worker, the peer navigator, has a relationship with an institution, then they're more likely to give it a chance than just them doing it on their own. So that middle person is so critical moving forward.
That was great. No, thank you so much. That makes so much sense. And perfect answer to my very vague question.
And we're also, I know, the Mental Health Technology Transfer Center, the Hispanic and Latino side, we just wrote a book on essentially looking exactly at this, how historical trauma continues to manifest, and what we can do to essentially heal current generations, so that way they don't continue to essentially pass that trauma on. So
what is the book?
It's called ¿Quiénes somos y de dónde venimos? A historical context into working with Latinx immigrants in the United States. So if you look at the Mental Health Technology Transfer Center, so MHTTC, the Hispanic Latino, it's right up front. It's ¿Quiénes somos y de dónde venimos? Is who we are and where we're coming from, which it translates to.
Thank you so much.
I appreciate also, there's another question. We're just about out of time, but Dr. Rojas, if you don't mind, I'll let Christina ask it. But Christina, please make it very quick.
Yeah, I will be really quick. Sorry, I don't know if my Wi-Fi is cutting out or not. I was cutting in out the last few minutes, but thank you so much for coming and sharing your information with us. I found the presentation really helpful and informative. I was really interested in I know you mentioned the difference between like how Latinx women and men responded differently to trauma. Like, for example, women presented more anxiety symptoms and men were like more likely to use substances. I learned a little bit about like Marianismo and machismo culture in my class on Spanish for medical professionals. And I was wondering if like that has an impact on mental health between Latinx men and women, and like what providers can do to address that.
Yeah, thank you for bringing up that question. Very much so. Right, Marianismo is this idea of purity. It essentially comes from colonial mentality of purity and Virgin Mary. Essentially, that's where it comes from, right? This idea that the woman has this role and she sacrifices everything for her family and her children, and she is to remain pure across all levels. You have machismo, and we're starting to look at that on a spectrum because we have caballerismo. Machismo tends to be toxic masculinity in the US, right? That's the way it translates. And we're starting to see that these cultural values do play a significant role in terms of how one engages in treatment or how one perceives mental health in general. So one of the things that we do to bring in, and this is what our team is doing at the Hispanic Clinic, is how do we use cultural values to inform our practice? So the way we're doing is specifically in working with women and if you've, the latter part of the talk really focused on the well-being, one of the ways that we talk about mental health is we sell it in the way that this treatment is not for you, but essentially it is, but we say it's for your family. When you say that it's for your family, then people are like, okay, I'm going to go ahead and do this because it's for them. Essentially, what we're doing is going around, we're trying to find a backdoor into treatment. So when you involve a larger context for your community, for your family, your immediate or extended family, then people say, yeah, I need to do this because that's going to help them out. But in the process, you're healing them, so then they go back and to help heal in the healing process. But we do use these cultural values or cultural practices to really inform our treatment. And when we think about it, when we think about Marianismo and Machismo, they suggest like you are to be able to handle all this and overcome your problems on your own. You're supposed to be reliant, you're supposed to be strong. And that's where we're starting to look at values from a spectrum or the other side of the coin too, and trying to find that middle ground. But yeah, to answer your question, both of those values heavily impact and negatively impact treatment engagement and treatment adherence. So we're trying to, form it in the way of using what you're bringing from a strength-based approach. So family, critical, great. As the leader, at the matriarchy or the patriarchy of your family, this is your role, because by engaging in this, then you're going to help out your family. But essentially, that's our way in, and then treatment then becomes individualized. But we use a family system approach to it.
Thank you for that. It's important for us to think about, and many of us on the call work in the context of nursing or advanced practice nursing or in other mental health settings. So really understanding how to leverage cultural assets and sort of use that, like you said, as a way, entry point into more treatment acceptability among patients.
Yeah.
Thank you. This has been a pleasure. I had a list of questions I didn't get to ask, but I might just send those to you one-on-one. But I appreciate what you shared with us today. Thank you, everybody, for taking the time to join us. Thank you also to Marianne Marshak and Sohani Sadeshmak for their work in coordinating today's event. Stay tuned for other seminar series from the Office of Global Affairs and Planetary Health, and have a good day.
Yeah, thank you, everyone.